Here are some opinions collected from different South Asian countries regarding Frontline.
In response to the COVID-19 pandemic, the heroic frontline health workers play a critical role in battling against the deadly virus. They are our first defense, working tirelessly with compassion to provide support to our community. Bhutan, while the citizens were encouraged to do their part and stay home, our Bhutanese healthcare professionals ventured out to bolster the healthcare system.
My father has got infected of COVID-19. I have been there to care for my father for more than 20 days. I have seen many ups and downs during those 20 days. While talking about the role of a healthcare worker, I am very thankful towards the sisters especially. They saved my father 5 times. There was a drop of oxygen saturation 20%, 30%, 35% and once it was 0. In such a situation, duty sisters saved my father. You can imagine how I would feel about them saving my father's life. I lost hope for the well-being of my father. Healthcare workers are the god for me. They play a very crucial role in care and treatment of patients. These are my experiences. In the middle of the night at about 1 a.m., on-duty sisters in COVID ICU saved my father's life. Whatever I am saying is very real. There were more than 30 ICU patients and there were very few sisters. But still they were working very hard in the treatment of all those patients. They don't even care for their health and well-being. I cannot identify the sisters in PPE. I only saw her eyes, but she is God for me. My respect for the healthcare profession rose a lot. My father was very conscious regarding precautions for COVID infection. Me together with my sibling were not much serious about the illness unless our father got infected.
When the sky is dark as if it's night, hope seems lost. Everyone is left in despair, and that is the time a hero comes from the chaotic sky to save the day. Flying across the globe with a cap, fighting all the villains. That was the superhero we all knew, and everyone loves to watch that superhero on TV. When the COVID-19 virus struck our world like lightning out of nowhere, people knew nothing about it. Everyone was in panic and lost, but the hospital workers stood firm. The frontline workers were equally putting their lives on the line. Doctors, nurses go back to the work in these deadly situations as if working in the fire and nothing is cooler, but they are real-life superheroes. They are someone to look up to, and the moment they enter the hospital door is the most epic entrance anyone could show in cinema.
Namaste, I am Rupa Kesi, Managing Director for Kangaroo Kids International Preschool. I found that my husband was positive for COVID-19. He was admitted in hospital. I was there with him for his care during his stay at hospital. During those days, I found that the healthcare workers are very dedicated toward their duty. Our government is not being able to mobilize sufficient number of health workers. I heard that the doctor-to-patient ratio in context of our country is vague. It is not even 1:300,000. It is very difficult to fulfill the demand according to the need of the health services and the manpower according to the population size. Currently, during the state of pandemic of COVID-19, many developed countries are facing a crisis. Then how can we expect our country to face such a situation? In such a crucial state of crisis, health workers' dedication toward patient care is very, very praiseful. I even see that the nurses are working continuously over 24 hours for patient care. It is very praiseful to them.